Are you a physician who wants more autonomy in how you practice or fulfillment in your life? If so, you're in the right place. Welcome to the Change Physician podcast, where you can learn the mindset, skills, and strategies to create the life you want without selling out your morals or values. I'm your host, Dr. Melissa Cady, joined by my co-host, Dr. Kevin Cuccaro. And today, damn it. I'm going to say, I'm going to do this again.
Just leave it in there. Just leave it in there.
Okay.
We're human, folks. We make mistakes, and
let's try the host part again. I'm your host, Dr. Melissa Cady, joined by my co-host, Dr. Kevin Cuccaro. And today we'll be talking about part-timing. Is that what we're talking about?
Yeah, I want to talk about, things that the healthcare system or group practices could do to really optimize their system or practice.
There we go.
Right? And the reason this comes up is, and this is sort of outside the theme of what most of the Change Physician is about, right? So it's all personal control and identifying, making sure that you have choices and in creating a level of awareness that there are so many options for you. But the thing that actually drives me bat crazy is that if I was someone who was in a healthcare system, or I had a large group practice or even a small group practice, my focus would not be on these short-term revenue goals only. Right? How can we squeeze more blood out of a tournament? How can we throw more widgets? Granted, the widgets are human lives, so it's sad that we think about them this way. How can we squeeze them through this year and extract as much value as we can? Like, it normally would take us $75 to freeze off a mole. Let's send them through a value equity driven dermatology practice and increase it to $14,000. That was from an article I just read about private equity doing this stuff and increasing costs. But if you have a healthcare system and your greatest, what's the word I'm looking for? Not investment, but your greatest piece of your business essentially is your physicians, then why don't you optimize to create an environment where you have the best physicians, most satisfied physicians, most engaged physicians, so that they do the best work? Because that's like, if you were in a value-driven system and a system that actually worked, that would be crucial. And then how many of these places, this is the thing that kills me, how many healthcare systems and clinics keep burning out people like with horrible work environments, and so then they're getting a bunch of locums docs and paying a locum company twice as much as they would pay to have a physician. So instead of, again, and they're all short time, oh my God, we can't, part of it is a control thing. Oh my God, we can't give the physicians choice. And if one person wants to work part-time, then all the physicians want to work part-time. Well, who cares? First of all, that's not going to happen because not everybody wants to work part-time. But second of all, if you have a bunch of part-time docs and they're happy, healthy, engaged, delivering fantastic patient care because they're really liking what they're doing, how is that hurting you? And the people, someone will respond, well, we have to pay them bevis, blah, 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 blah. Well, you can create your pay structure in such a way that you're not necessarily losing tremendous amounts of revenue by doing this. Now, You may not have in the short term tons and as much revenue. So I guess if you have a non-physician healthcare CEO that has a bunch of stock options, that probably doesn't make a good idea because you're looking at short-term benefit for yourself, you greedy bastard. But from a healthcare system, if you're looking like in an entrepreneurial or business focus where who am I serving and what is the value that I'm getting reimbursed for, it would make so much more sense to create a system where you have happy docs in.
Yeah.
And that's not that hard. Like so the reason I want to jump on this, folks, and this was a topic we were just talking about offline, and I just started, like, we have to do an episode on this, is even locally with, for me and some of in a group I was with, it kept coming up that doctors wanted to go part-time, and they're like, hey, I'll put up all this other crap. All I want to do is work 3 days a week or whatever. And the amount of pushback and flack that they were getting when it was built into the pay structure that they would be making significantly less by doing this was insane, because now they left instead of staying, which means you had to now go out and recruit a new physician. And I should look this up, but for a family practice doc, on average, I was hearing the cost to acquire like a new one and get them through the first 2 years of practice is like hundreds of thousands of dollars. And if you have someone who has a contract for 2 years and then is not staying past your contract, you're losing a crap ton of money by having to recruit someone new and do all these new things again.
Mm-hmm.
So if you are, again, this is the change physician, this is for physicians, but if for some reason you're a physician, healthcare CEO or administrator out there, think differently, people, and start optimizing your business around your most key aspect, which is your physicians. The other key aspect is your patients. But if you're taking care of your physicians, they're going to be able to take care of your patients better. And so there's this win-win alignment here. And it just doesn't make sense to have this short-term, whoever consultancy, non-clinical people looking at widgets are trying to apply to a healthcare system. So that's my particular rant around this.
Well, and the thing is the reality, even from our last episode, is that there are other things that are important to people and not just work. Now, you may get a lot of gratification from your work, and it's very important. It's your livelihood. It's what you spend half your life training for. But there's also another reality, is that half of the graduates out of medical school are females. And until something changes about our evolution as humans, women are the ones that have to bear the children if the people want their families to have kids. And you can't skirt around that. And I think there's a lot of things about part-time that work for a lot of situations. People just have outside interests, have other things they love to do too. Doesn't mean medicine's even, any less important. But they're trying to juggle maybe 2 parents with a dementia. And, there's just so many things that could be going on in people's lives. And I think as a culture, we also need to check ourselves too, and not discount or think less than. And I know this has happened in my own personal experience, and friends of mine who are part-time for whether they're a mother or they just have other interests. And I think that it needs to become more commonplace so that it's not considered like a weird, they're not putting in as much time or taking as much call or whatnot. But the thing that people forget is they're making less than you. And so there is a cost benefit, or, there is a loss for them when it comes in terms of money. But what is of value to them is the extra time. So, I just think it's important for us to get to a point in our culture, if you're a physician or a CEO of a, or administrator of a hospital or whatnot, that you consider that this is going to create, like Dr. Cuccaro said, happier people where they can tend to the things that matter to them the most. And they shouldn't be ostracized or criticized for taking less pay for working less. So I think it's a very valuable thing to do.
Imagine that.
I know.
I'm mad at you because you're taking less pay because you're working less hours. Okay. That's crazy. But, that fits with healthcare. And the other thing about this is, and this just made me think of, if you recognize that physicians are your key asset, then if you're designing or optimizing a healthcare system, what you really should be thinking is, how can I invest in my assets so that they're happy to spend their entire career here? And maybe that career would evolve. So you can almost reverse it. So you were talking about early childhood years. So a lot of physicians go through training. A lot of people don't have, if they, they may go off into their first practice and maybe they're starting to think about having families. Now, my wife and I, who's also a physician, we did that during residency. That's just a whole nother episode right there. There's some really good reasons to do that. There's some other hard things about it. But so, what if you're looking at that and you're going from a physician, a physician-centric model with a goal, and I want to frame this because I don't ever want to lose focus on the patient either, that we're delivering ultimate value to the patient. But if you're centering on making sure that your physicians are happy, if you can introduce, so now they're having young families. Well, the thing they don't have in it is time. So now you would say, hey, we're going to introduce these part-time practice models so that you have more time to spend with your young children. Because as your kids get older, folks, and those people who have kids recognize this, as your kids get older, they need you less. And so then what happens is, maybe instead of doing this idea of work yourself to death, have no time, don't see your kids ever, and then tailor off at the end. We changed the model somewhat. So now you have more time at the beginning. So that if you have if you don't, if you want to start off hardcore, fine. But if you have kids and you want to take that time, is now you have a practice environment that supports you as a family. And then as you support that physician, they're more likely to be engaged in your system, and they want to stay there. And then as their kids get older, now they can say, hey, you know what, I have more time, and I know college is coming up. Maybe I want to add in some more college. So instead of going full-time to part-time, you actually can create an environment where there's people going part-time to fuller time, right? Like my kids are going to be leaving for college in a couple of years. My time is going to open up. It's going to be a lot different with them. So, and if I was in more of a traditional practice, that would totally change my mindset. It would certainly change my degree of devotion to the institution and support that institution. So we just need a little bit more out of the box thinking with this stuff. And there's, I know there's physicians that are in places of control, because there's a lot of physician execs, and people tend to look at them like they're sellouts. And I'm like, not all of the people who go into healthcare administration, a lot of them have started that journey trying to make a difference. Their change as a physician became because they wanted to become involved to make things better.
Yeah.
So if that's you, I just put out some ideas of how can you support this absolutely crucial aspect to healthcare, because it doesn't matter if we change the payment model from fee-for-service to value-based care. The key asset that you need to invest in to support the goal, which is patient wellness, is going to be your physicians.
Yep.
So maybe we should start from the beginning rather than see them as the enemy, as some systems seem to do.
No, I think that's an excellent point. And, like you said, we need physician wellness to have the best patient wellness, because believe it or not, it actually impacts the people that physicians are serving, which is our patients. So we need adaptability in our own medical system when it comes to, leveraging the best layout and setup for physicians, and really set them up for success, and don't pigeonhole them into one thing that doesn't seem adaptable for our human lives.
Yeah, and so just kind of end this episode. I mean, I don't want anybody to assume that just because I'm a physician and you're a physician and we're talking to a physician audience, that what we're saying is that the physicians need to have some sort of golden special privilege. It's not that at all. It's just the recognition, because you can do this in any environment. If you are in a business, of which almost all business are, where there's a customer service element, where you're the person that you serve, this customer, in healthcare, it's the patient. If you want to provide them good service, you got to make sure the people who are providing the service to them are happy as well. Mm-hmm. And so we're not optimizing because we're only thinking about physicians. What we're trying to do is construct, or encouraging people in practices and systems to construct an environment that develops an asset, which is your physician, so that they can provide the best care to your customer, who is your patient. Again, and so it's not like saying that physicians need to be paid $500,000 a year to work 2 days a week. That's not it at all. And most physicians wouldn't even be pushing that, because, as you said, they're willing to take less if they have better life. Mm-hmm. Those life and time and hours. So anyway,
I did.
So you did. Yeah.
And you did.
But anyway, so, again, just kind of wrap this up here and hopefully this wasn't too much of a rant, but this really is recognizing from a healthcare standpoint, if you're a physician, and particularly if you have a practice-driven environment and you're wondering why you can't keep doctors, is to flip the head on what you're viewing people as and say, if these are assets, how can I design a system that encourages them, engages them, and keeps them here so they can deliver ultimate value to my clientele. Yeah. And with that, I would just say, thanks for joining us. This is the Change Physician podcast. If you have any questions or comments, please reach out and talk to us. If you have a guest that you would like to see on the show, absolutely let us know. And you can find more at thechangedphysician.com. Thanks, folks.